helping make your life easier. Moms Every Day.
Hey everyone, it's Addie Cheek with Moms Every Day. Hope everyone's having a great Thursday. Today we have Dr. Pauley with us from Capital Huntington Hospital, and we're talking about screening for cervical cancer. So you're a gynecologist working with Marshall Obstetrics.
Yes.
Talk about the cervical cancer screening method. What is it?
So cervical cancer screening is done to remove a sample of cells from the cervix to see if there are any changes in those cells that are precancerous or that could lead to cervical cancer in the future. Cervical cancer screening over the last 30 years in the U.S. has decreased cervical cancer by 50%.
Which is awesome.
Yes, definitely. Most cervical cancers are actually in patients that either aren't screened or adequately screened. And so we have the Pap test and then HPV testing.
Okay.
The Pap smear is basically you just take a small brush and take a sample of the cells from the cervix, and then we send those to the lab, and those are looked at to make sure there aren't any precancerous changes. And then some women should also get HPV testing, and so it's actually DNA testing on those same cells to see if they've been exposed to the HPV gene, which is the human papillomavirus. The human papillomavirus, there's several hundred strains, but there are some that cause cervical cancer, and that's what causes the majority of cervical cancer.
Okay, and so the process of that, I mean, a Pap smear I think we've all heard of, and we know that eventually there's a time where you have to consistently go every once in a while to get that done.
Yes.
Well, when you have to get the second procedure done, when you're going in and they are checking to see if you do have those HPV cells, what is that process like?
So it's actually the same test. It's done from the same cells that are collected for the Pap smear.
Okay.
It's just recommended for women ages 30 and over.
Okay. All right, and then who should have the cervical cancer screening done?
So we start Pap smears at age 21,
Okay.
and women ages 21 to 29 should get Pap smears every 3 years. And then women over 30 should actually have the Pap smear with the HPV testing done every 5 years, or if they're at a facility that doesn't do the HPV testing, they can also get the actual Pap smear every 3 years.
Okay, is there ever a point in your life when you can stop getting these things done?
Yeah, so patients that are 65 and older that have had the last 3 Pap smears or 2 Paps with the HPV testing done in the last 10 years that are normal don't need Pap smears anymore. And then patients that have had hysterectomies, if they never had precancerous cells or cancerous cells prior to the hysterectomy, they don't need Pap smears anymore as well. So we usually use 65 as the cutoff, as long as they've had normal screening up until that point.
Now, is there any medical risk doing it past that point if they have never had issues in the past? Is there a reason you want to cut it off?
There's really no medical risk in not doing them. It's just if they have not had any abnormal cells prior to that point, the chances of that are extremely low. Now, it is still important. Pap smear is just part of the well woman visit, so it's still important that even though we're going to do this screening every 3 years or every 5 years, that they get their well woman visit still, because we're going to be assessing uterus, ovaries, vaccinations, other screening labs, and just making sure their overall health is good.
Right, so there's a lot more that goes into an actual just going in for a visit than just a Pap smear.
Absolutely.
What if you do get an abnormal screening overall after all of your screening and it is abnormal? What happens then?
So part of that is based on the age. The guidelines for screening that we talked about actually changed in October of 2012 to what I just mentioned. Young women most of the time will clear the virus on their own, so a lot of times we'll just repeat the Pap smear in a year. But most other patients will get what's called a colposcopy, and so basically we just look at the cervix under a microscope and biopsy any areas that appear abnormal to make sure that they don't have any precancerous or cancerous changes.
Okay, and then just overall prevention of cervical cancer, how can you do this?
So Gardasil vaccine is what we recommend right now. We target it for patients ages 11 and 12, but any woman or any girl ages 9 to 26 can get the vaccine, and men ages 9 to 21. And that actually has protective effect against cervical cancer up to 100% in the study. So the Gardasil vaccine is very important in prevention of cervical cancer.
So boys and girls can
Absolutely.
both get Gardasil now. And I think I've talked about this before, the Gardasil vaccination, it has gotten better since it came out in the first place.
Yes, when it first came out, it only covered 4 strains of the HPV virus, and now it actually covers 9 strains, and that just came out this year. So we're getting better protection all the time.
And like you said, there are several strains of HPV, more than 9.
Absolutely, there are hundreds.
Hundreds of strains of HPV. So just being able to keep anybody protected, you suggest going with the Gardasil shot.
Yes. Yes, definitely.
All right. Thank you so much for the information.
Thank you.
Of course, if you need any more, you can just head to our website, which is WSIZ.com. Click on the Moms Everyday tab. You can rewatch the interview, find the info that you need. Of course, we're so glad that you checked in with us for Moms Everyday today. We'll see you again tomorrow. Have a great Thursday. Take care, guys.